evening, everyone. I'm Linda Watson with Skyridge Medical Center, and as you can tell by the background, I am celebrating Heart Month, and we are so proud and pleased that Dr. Jessica Ridgley is continuing her quarterly educational series that has been so popular among our community members. And of course, it's February, so she'll be talking about natural ways to improve heart health. So without further ado, Dr. Ridgley, please take it away.
Hi, I'm Dr. Ridgley, and I work at Skyridge Primary Care in Lone Tree. And I did put my information there. Today, we are going to talk about change of heart, natural ways to improve heart health. And as you can see, I'm also kind of going into the heart theme today, and I hope you guys enjoy the talk. Hold on. There we go. So this is the plan for today. I did get a little overzealous in what I put into this, so we may not hit everything, but I do think we'll get the big points. The initial part is going to be bring me to lifestyle. As we all know that lifestyle is very important in heart health. So we will talk about that initially. It will also talk about where the heart and the stomach meet, so talking more about diet and different foods that can actually be really helpful in helping with heart. We will also talk about hypertension, so good marks for hypertension, different things that can help us bring those high numbers into a more appropriate range and where we need for good health. And then also we'll talk about cholesterol, the numbers game. It's not really a numbers game, but I know to a lot of patients it seems that we talk a lot about the numbers of cholesterol, and so I'm going to talk about why that's so important. And then hopefully the two that I'm hoping that we'll get to, and we'll kind of see how timing goes, is the beat goes on, which is talking about some arrhythmias, different things that can be helpful with that, and pump up the volume, which when we talk a little bit about congestive heart failure and ways we can help to improve our own outcomes with this. All right, moving on. Bring me to lifestyle. We're going to talk about smoking, exercise, what we eat, making sure that we sleep, and relaxing. So tobacco, I want to address that because it is really important to not smoke. Smoking increases blood pressure, it'll increase your heart rate, it decreases blood flow to the heart, it also decreases oxygen flow to the tissues, and it is actually associated with blood clots, which can also create further issues including stroke, and is also linked to depression and increasing stress. So all of those are very important reasons to stop smoking if you are, and to not consider smoking if you aren't. When you quit smoking, we instantly start to improve our own health. For one, when it comes to heart health, we have a significant improvement in heart attacks by decreasing our risk almost immediately. And it also saves thousands of dollars. I think I calculated it yesterday, and it was around $3,000 yearly that you could save if you are a 1 pack per day smoker and you choose to stop smoking. So that's quite a bit. And for some people that's a big reason. For some people it's not so much. But I highly recommend quitting smoking if you are. The next thing that we're going to talk about is exercise. Exercise is very important. And the amount that we need per week is a minimum of 150 minutes weekly of light to moderate exercise. So if you have a preference for exercising, like doing walking or some light exercise, then you will want to get in that full 150 minutes per week. But I actually did a little bit of recent study, and if you're doing moderate to high intensity, then you're actually looking at 75 to 115 minutes per week. And so what does low, moderate, high intensity actually mean? Low intensity is about 90 to 120 beats per minute, maintaining that consistently. Like if you're walking and you get your heart rate up to 100, that would be considered light exercise. Moderate exercise is about 120 to 140 beats per minute. And then high intensity is about 140 to 160 beats per minute. And of course, that does vary from a safety perspective depending on age. So a good place to stay is around that moderate to exercise. The best split overall when you're talking about time spent is going to be to do 40% cardio, 40% resistance, or about 20% flexibility, and about 20% flexibility. The types of workouts that can be really helpful are your HIIT exercises. Orange Theory is one of them, but what we're talking about is any type of exercise that involves both a little bit of cardio and resistance. Some of the things that used to be really big are like P90X and Beachbody that could be very helpful in getting kind of all that resistance and cardio as well. But the important thing is to not forget that the flexibility is also important when you're doing that. One of the things that I give my patients is called a graded exercise program. And that graded exercise program is for those people who have either never really been active in exercise, or you've been active in exercise but have just kind of stopped being as active in exercise and you just don't have that habit anymore. It's very hard to reestablish the habit. So this is what I recommend to my patients to reestablish it. And you start out at 5 minutes every day for 1 month. 5 minutes. And I tell people to stay pretty consistent with not doing more than that in a certain period of time. So I think 5 minutes every day for that month is a great way to just start that habit. And after that month, you go to 10 minutes for a month. And you do that for 10 minutes every day. And then by the third month, you have 15 minutes every day. And usually most people can do between 5 to 15 minutes every day if you establish a good set time to do that practice. And then by month 4, you're about 20 minutes in. You can start to change that to about 5 days per week so that it doesn't become too overwhelming. And then by 6 months, you're at 30 minutes about 5 days a week. And then big things are that I recommend doing it at the same time every day, because the whole point of a graded exercise program is to establish that habit. And so you start to notice that you feel better. So you do this every single day. And you work until you're breathless. So even if you're doing 5 minutes, by about this 2 to 3 minute mark, you should be feeling a little as if you're not, you kind of want to stop, but not to the point that you have to stop. And you maintain that through that full 5 minutes. And the same thing as you're continuing through it, you kind of work up, you kind of warm yourself up, and you get to the point where if you were carrying on a conversation, you might have to stop a little bit to take some deeper breaths to maintain the conversation. And the other thing is, once you're at that 20 to 30 minutes, you start working in some resistance and flexibility. You can start to do, a 5-minute warm up, a 15-minute cardio, 10 minutes of a little bit of resistance, and then 5 minutes of flexibility at that 30-minute time frame to start to be able to get all of those in. We've gone 0.04 miles. Shouldn't we stop? Let's keep going. No, let's actually stop. I know that this is how my brain feels every time I work out in the beginning. And I actually love to work out, but I feel this pretty much every time. And I know when we're starting to work out, this is how we always feel. And it's hard to keep going, but know that the exercise is going to be one of the best things you can do for your health in general, not just for your heart, but for everything. All right, you are what you eat. When our parents used to say that, they were absolutely right. And the two diets that overall, when we look at science in cardiology that seem to be the most helpful is the DASH2 diet and the Mediterranean diet. They seem to have the most information as well as most data as to their support for cardiac health. So let me talk a little bit about what those two differences are. The DASH2 diet, it limits fatty meats. So it does allow meats, but it actually recommends to be mostly vegetarian. And it also limits any full fat dairy. So it is a low fat diet. They usually say around 20% of fat in your diet for the DASH2 diet. The other big thing that the DASH2 diet is, and why it became popular, was what it could do for blood pressure. And it talks mostly in the beginning about the DASH diet was about your sodium levels. So keeping your sodium levels under 2.4 grams of sodium per day. Since then, they've kind of modified that, and that's where the DASH2 diet came from. And we're looking at the more you can actually get your sodium levels down to 1.5 grams per day, the better off from a blood pressure perspective. But overall, it has a low sodium quality to it. It also recommends about 7 to 9 servings of fruits and vegetables per day. So what is a serving? A serving for most fruits is either going to be the fruit or is going to be about a cup of a fruit, say like blueberries, which honestly, blueberries are amazing. I'm going to talk a little bit more about them further on, but they are about half a cup is the serving size. When you're talking about some of your harder vegetables or your leafy greens, you're talking about 1 cup as a serving size. But if you cook them, then you're still talking about a half a cup. If you were to cook spinach, it's about a half a cup, where I tell most people just, grab the lettuce with your hand and whatever fits in your hand. And, when you grab that lettuce is about a serving size for lettuce. And then a lot of other things, if they're cooked, it's a half a cup. And if it's not cooked, it's about a cup. So 5 to 6 servings of vegetables and 3 to 4 servings of fruit. The difference, the other thing is it does talk about whole grains. And when we're talking about whole grains, we're talking about like whole grains. Like, for example, doing steel cut oats is better than doing just regular oatmeal, and making it from scratch is better than doing it with instant. Also, a lot of nuts, seeds, and beans is recommended in the DASH2 diet. The Mediterranean diet is different. It has a lot of the same qualities, except it does allow more plant fats and more of an emphasis on omega-3s, especially fish. And it does allow a small serving of alcohol per day if you do not have any chronic issues that would keep you from doing that. Red wine obviously is the best because of the resveratrol, which is the antioxidant that you find in the wine. The thing that I have a little bit of a problem with these diets is that, and most diets, honestly, in general, is that they don't really talk about what is necessary to maintain body health from a protein perspective. And in one of my other talks, I talk a lot more about nutrition, and I talk about protein being that basis foundation for everything that your body is built upon. And our body is constantly changing. It actually changes every cell within 7 years, and every actually molecule. So when you're talking about protein, it's really important to make sure that you're getting enough protein. And that base for protein is actually 1 gram per kilogram ideal body weight. So, if you're around 150 pounds, that's going to be 70 kilograms, and you'd want to get a minimum of 70 grams of protein per day. And that does not mean you have to get it through meat, but you should be getting that amount of protein, period. And then if you're working out, you do want to start increasing that between 0.25 to 0.5 extra grams per day, per kilogram. When it comes to sugar is definitely by far one of the worst things that we can have in our diet when it comes to our overall chronic diseases and health. I recommend added sugar to be less than 40 grams per day. To give an idea what that means, a soda is 30 grams in just one 12-ounce serving. So that's a good idea about how much you would say a cookie would be, usually around 10 grams of added sugar. And when you look at sauces and you look at fruit juices and those kinds of things, it's pretty amazing how much added sugar we put in things. So if you're trying to get your added sugars to be decreased, you definitely want to make sure you're looking at your nutrition labels and cutting those things out. A question I get a lot is, if you can't do sugar or added sugar, what can you do? A lot of the same things like sucralose and aspartame and those things honestly have not been found to be very healthy for us, probably not any more than sugar. So I typically recommend monk fruit or stevia as two safe ones. Erythritol is moderately safe, but it's not as safe as the other two. And then also about 1 to 2 servings of grain per day. Grain is not really needed in our diet. I know I've said this before. I'm going to say it again though, that we our genetics actually go back 20,000 years. It has not changed significantly since then. Grains didn't actually come into our kind of purview or start to do that until we started farming, and that was around 10 to 12,000 years ago. So our genetics don't require grains. They do have a lot of whole grains have great nutrients that can be very helpful, but they're not absolutely necessary in our diet. I also recommend a multivitamin for the same reason that I just said. Those people back then, 20,000 years ago, they were a lot more active than we are today. And therefore, they were eating a lot more than we are because they could. If we were to eat what they had been eating, we would be fat. And that's not exactly what we're looking for. So we try to kind of minimize our calories, but in the same time, in minimizing, a lot of times we also minimize the nutrients that we need to be getting. So I do recommend a really good whole food based multivitamin added to your daily regimen. The other thing that I highly recommend, either through food or through a supplement, is omega-3 fatty acids. There's 3 types. There's ALA, EPA, and DHA. And you want about 12 grams per week of that mix. From the EPA and DHA standpoint, we don't have the capacity to efficiently change ALA to EPA and DHA. And EPA and DHA are mostly found in fish, grass-fed beef, pasture-raised chickens, and eggs, wild meats, and that kind of thing. So it's important to understand where it comes from. Fish are by far your best source. And if you were to do 2 4-ounce servings of like salmon or halibut in a week, you would get around the amount of EPA and DHA that you need just in those 2 meals. So it's not too difficult, but omega-3 fatty acids are super important to make sure we're getting enough of. And in our culture, we eat way too many omega-6s and not enough omega-3s. The last time they calculated it, it was about 20 to 1 omega-6 to omega-3s, and that should be a 1-to-1 ratio. So really important to make sure you're getting those omega-3s and ensuring that you're also getting those EPA and DHA. The ALA you get through mostly like your nuts and your seeds and vegetables and that kind of thing. All right, so this was a pretty little picture that I found, and I decided on this instead of putting a bunch of words that I would kind of show the different foods that can be really helpful in regards to heart health. So your dark leafy greens, your leafy greens, and even your like broccolis and that kind of thing, they're very high in nitrate. And I know that sometimes we hear about nitrates in a negative form of like barbecue and the fact that those can be carcinogenic, but these are very different nitrates. And these nitrates that we find in these dark leafy greens and a few other different things, which I'll talk further about, actually increases nitric oxide in your system. And what nitric oxide does is it actually protects the arteries, that arterial wall on the inside, and it actually helps them to relax. So it helps blood pressure. So those dark leafy greens are really important. You have berries, which blueberries are probably one of the best, but all of the berries have a little bit of this antioxidant called echinocyanin, which decreases cardiovascular disease and improves diabetes. It is neuroprotective, and it also helps to decrease oxidative stress. So I definitely recommend berries on a daily basis if you can. Another big one there, which is one of my favorite fruits, is avocados. The recommendation from a scientific perspective is about 2 servings per week, and a serving is about a half of an avocado. And that will decrease cholesterol and cardiovascular disease. It also improves the particle size of cholesterol. And I'm going to talk about that more when we get to cholesterol, but particle size is very important. And it actually reflects how inflamed overall how much inflammation we have in our system. So it's a number, but at the same time, it has a lot that it talks about. So avocados are really helpful, and they also help to increase potassium. We talked a little bit about omega-3s already. That's that EPA, the DHA, and ALA. And they have a role in the cell membranes in every single cell in the body. So it doesn't just affect heart, it affects every single cell, and it helps to improve signaling molecules so that our body is able to communicate with each other from all perspectives. It decreases inflammation significantly, and we need around 1.2 to 1.6 grams per day. And that's just of the EPA and DHA, and then the ALA you need between 800 milligrams to 1 gram per day. All right, so let's talk about some walnuts, and then we also have some almonds in there. Those have a lot of nutrients and minerals in them, such as magnesium, copper, and manganese, and it can help to decrease the LDL, that count of the LDL, including decreased cardiovascular disease, and it decreases mortality from cardiovascular disease, as well as decreasing the potential arrhythmias that can come from heart disease. So those are all really important. Beans, which are there over by the apple, those can decrease LDL. It improves insulin a lot because of the fiber, and it helps glycemic control. Chia seeds are pretty awesome. Those are in that middle heart. They have that grayish appearance. They have tons of fiber in them, tons of omega-3s in the form of ALA, and they can actually help to decrease blood pressure and improve platelet aggregation. And what that means is platelets are kind of the beginning step of what causes the plaquing that develops in the arteries. So that can be really helpful to make sure that we decrease that the platelet aggregation from inflammation. So, and then we also have hemp in there. Hemp is from marijuana, but it is actually the leaves from it, and it has a very high amount of arginine. And arginine is one of those other ones that has nitrates in it that help to decrease nitric oxide or increase nitric oxide and help protect those vessels. One of the biggest ones is garlic, and that's over there on the left-hand side over by the salmon. And garlic has something called allicin in it. And allicin is a compound that can break down if the clove is already opened, but it decreases blood pressure and platelet aggregation. And it actually helps to increase the gut microbiome, which is also very important. And that is also very important in signaling. And it helps to keep vampires away, just in case you're concerned about that. It will help keep the vampires away. So lots of garlic is good for you. Olive oil, which is right there in that center area, that helps to decrease the risk of dying from heart disease. And the studies that were done that shows that every 10 grams per day of olive oil, which is really not that much, it's about like a tablespoon, decreases the risk of cardiovascular disease by about 10%. And that actually continued even as you get into like the 40 and 50 grams per day. So olive oil is actually very protective. And then green tea isn't on here, I don't think, but green tea improves appetite control. And I know most of us could probably benefit from that. It also increases fat burning, it decreases LDL, and it's cancer preventive. So that's a very good one as well. All right, so I did allude to some of my other ones that I have done, and the nutrition basic truths and dispelling myths. I talk a lot about what is the most important things that you need in your diet, no matter what the diet is, whether it's the DASH2 diet or the Mediterranean diet or the keto diet or your intermittent fasting. These are the things that you absolutely have to have for a healthy diet. And you can actually find me by going to Jessica Ridgley DO on YouTube, and that will bring up that nutrition basic truths and dispelling myths. And so if you have any questions or concerns about knowing what the most important things with nutrition, I do highly recommend that one. The other thing that is incredibly important when it comes to cardiovascular disease is stress. And so if you're not getting enough sleep, it will impair your heart. It'll impair your brain, it'll impair a lot of things, but it definitely has a significant effect on heart health. The recommended amount for adults is between 7 to 9 hours per day or at night. And many many patients that I see will tell me, oh, well, I just don't require that. But I think that many people don't realize that if you actually do get that amount, that overall you are much more productive throughout the day. And all the scientific studies have really shown that. I do have a sleep um, webinar as well. It's Off to Bed I Go. Same thing, you can go to YouTube and search me, and that can be very helpful. I talk a lot about different supplements and nutrients that could be very helpful in going to sleep, and as well as different problems like not being able to fall asleep or waking up in the middle of the night and not being able to go back to sleep. So if you do have that problem, I highly recommend you look at it and work on trying to get more sleep, because that's just as important, the exercise and the diet. So now I would like everybody who's with us I'd like to invite you to just relax for a minute. And I'd like to do a little bit of a meditation, because meditation has been found to be very significant in our health and overall, but they've done many studies on heart health and meditation. And stress is probably one of the most important things that can affect our health overall. One of the things I think a lot of people know, but I think it bears repeating, is that the most often time for people to have a heart attack is either Sunday night or Monday morning before they have to go back to work. And it's very important for us to realize that we need that time off with our families and our friends, and just being able to decompress. And one of the ways to do that, if we're in a really stressful time in our life, is to do some meditation. So I'm going to ask you all to just close your eyes, and we're going to do some counted breathing. And I'm going to start off the counted breathing, but just close your eyes, relax, sit back in your chair. I want you to kind of notice any sensations in your body, like, is your head buzzing? Does your chest feel a little tense? Is your body feel tense? Is your breath short? All these things are signs that we're having increasing stress. So just notice this. And then I want you to start to inhale, and we're going to count 1, 2, 3, 4, 5. Pause. And then out. 1, 2, 3, 4, 5. Pause. And breathe in again. 1, 2, 3, 4, 5. Pause and breathe out. 1, 2, 3, 4, 5. Pause. And I want you guys to start counting that to yourself out loud or in your head. And that is fine to do it either way. You do want to do about 1 second for each breath as you're breathing in for 5 seconds and 5 seconds out. And as you're starting to relax into your chair, I want you to think about your favorite place in the entire world. It could be something from your past, from your present, somewhere you'd like to be in your future. It doesn't really matter where that place is. I want you to imagine yourself there, taking these nice, long, deep breaths. And continue to count, but feel your body just relax into whatever place you are, whatever, if you're lying or if you're sitting, just allow yourself to relax completely into it. Let all your muscles go. Continue to count. And let's do a couple more breaths, counting 5 in and 5 out. So start to come back from that special place. And I want you to you don't have to continue with the counted breathing, but try to continue to take some deeper breaths as we continue to go through this. This is not a stressful time. It's a time to just kind of learn some things. So just stay relaxed as we continue to go through the rest of it. And I want you to notice at this time the sensations in your head and your chest and see if that's changed any. See if it feels a little bit more lighter. I don't think more lighter is actually a word, but anyway, it feels lighter. Chest feels a little less tight. Muscles feel a little bit more relaxed. And just take stock in how you feel, knowing that if you were to take more time with this, especially every single day, the more it kind of starts to take you out of that fight or flight and put you into that rest and relax and really help in the future. And the more you do it, the better off you'll be. So moving on from our little relaxing time, date night, you, me, and a moderate amount of red wine and dark chocolate. That sounds like something I could definitely go for. This St. Luke's is actually from my hometown in Kansas City. And I found these online when I was looking for funny memes, and I thought that this was really cute. So right about now, especially around Valentine's Day, that might be something that we all have to do. All right, moving on to blood pressure. So good marks for blood pressure. Let's talk about what is actually the recommendation these days. It seems to change quite a bit. We've actually found that if we overtreat blood pressure, we cause other issues. So the numbers have relaxed a little bit from that perspective. So when we're talking about over the age of 60, they recommend keeping systolic under 140 and diastolic under 90. If under 60, the recommendation is under 90. Usually up until about the age of 60, it doesn't seem to have as much of an effect, but over time, even a high systolic is going to have a significant effect on the heart. So I typically recommend keeping it between about 110 to 130 for younger individuals, and as we start to get a little bit older, kind of allowing that to go up a little bit and then starting to go up until the 140 area. If you have any kind of chronic kidney disease or diabetes, the recommendation is to maintain it under 140 over 90. And to know what an hypertensive crisis is a systolic number over 180 or a diastolic over 120. And that's actually really high. For most people, especially that diastolic, they'll start to feel kind of funny in the head, sometimes maybe have a headache, things like that. So just understand that it's really important to kind of make sure you're keeping that within range. It's also important to know that stress affects blood pressure quite a bit. And so if we're coming home from a stressful event in traffic, our blood pressure is going to be higher. And the important thing is if you have had a stressful event and you take your blood pressure and it's high, to take it, try to go relax and take it a little bit later and see where it is. But don't let it go above that hypertensive crisis area, which can eventually lead you to the hospital if it's not treated. So when it comes to medications, for non-Black individuals, thiazide is the first recommendation, amlodipine or ACE and ARB is the second. For Black individuals, thiazide and amlodipine are also the primary. That's kind of changed a little bit recently, and they do note that cardiovascular system is slightly different in our African American individuals, and so making sure that we're kind of focusing in on that diuretic first is actually really important. But those are the recommendations. If you do have any findings for kidney issues, the ACE and the ARB are super important as well. So those, and the ACE and ARB is like lisinopril or losartan. So to know what those are. All right, so here we have another one talking about hypertension and the things that can be helpful with hypertension. So we already talked about the DASH diet and the Mediterranean diet a little bit. But what do they do? So the DASH diet can actually decrease blood pressure up to about 11 points in systolic and up to about 5 to 6 with the diastolic. Mediterranean decreases it by about 3 because there is not as much of a focus on the sodium in your Mediterranean diet as it is in your DASH diet. And remember what I was talking about with the sodium level makes a huge difference. So if you were to focus on a low sodium diet of 1.5 grams per day, you'd hit more of that 11 than you would if you were at that 2 to 2.4 for the DASH diet and the Mediterranean diet. We also have nitrate-rich foods, which I told you the dark leafy greens were one of them, but also beets, carrots, turnips, cocoa. Cocoa is the next one over, and one of my favorites of all time. I use a lot of cocoa and a lot of different things, sometimes with a little bit of sugar, sometimes without. But cocoa, the recommendation for dark chocolate is a 70% dark, and in a standard chocolate bar, it'd be about 1/4 of that standard chocolate bar is enough to actually increase the nitrates in your system, and it can potentially decrease your systolic by 8 and decrease your diastolic by 5. So that's actually pretty potent overall. Fiber is also really important, something that I'll talk about more with cholesterol as well, because fiber is just overall really important from a perspective of decreasing inflammation in your system. A lot of people think of grains, and honestly, this fiber picture does have some grains in it, and that's fine. There are grains, but grains are probably not the most efficient way to get fiber. You're going to get a significant more amount by doing your fruits and vegetables than you would by oatmeal. A lot of people I'll talk about adding fiber and they'll add oatmeal, but the reality is the bowl of oatmeal only has about 2 grams of fiber, whereas if you were to do a 4th cup of blueberries in it, now you have another 4 grams of fiber and a 1/4 a cup of nuts, and you have another 2 grams. So, and then those other things like the blueberries and the nuts have things that help with cholesterol and blood pressure and all sorts of things. So I highly recommend trying to get most of your fiber through fruits and vegetables and just a little bit from grains. Then we also have our omega-3s, which we talked about. I talked about 1.2 to 1.6 grams per day, especially of the EPA and DHA, and then about 1 gram, 800 milligrams to 1 gram of the ALA. Making sure that you're getting enough of your omega-3s actually decreases your systolic blood pressure by 6 and the diastolic by 4. So not quite as big as the nitrate-rich foods or your DASH diet and the sodium levels, but still pretty good. And if you were to start mixing these things together, the more and more you're going to see that decrease. I decided to add in a botanical called hawthorn berry. It actually has tons of effect from many different perspectives of the heart. The studies actually vary in effect when it comes to blood pressure, but it has an ACE inhibitor-like effect. So it actually acts a little bit like lisinopril, and it protects the kidneys. It has a protective effect to the kidneys. There's no known medicine interactions, as well as dietary interactions or other supplements, and it is safe up to a really high dose of 1.6 grams per day. But that is actually not the amount that's actually needed for most effective doses when it comes to cardiovascular. As a matter of fact, for blood pressure, 160 to 300 milligrams was found to be effective in helping to reduce blood pressure. Then we have aged garlic extract. That is something that we talk about a lot we talked about that before. When it comes to blood pressure, it's about 2 cloves per day, which can be helpful. That aged garlic extract is actually more potent. You can get it as a supplement, and it has higher amounts of allicin in it. And that can actually decrease your systolic blood pressure by 16 points and your diastolic by 9. So that's pretty profound. That's probably the best one so far. So, definitely keeping away those vampires and eating a little bit more like an Italian might be helpful. And then we have meditation, which we talked about. We did a little bit of. Doing 10 to 20 minutes per day can decrease your systolic from 5 to 10 in the systolic, and then the diastolic is 3 to 7. So super important. I decided to bring in something a little different in my next picture called earthing. Some people call it grounding. And I think there's a lot of confusion surrounding what earthing and grounding actually is. So when we talk about grounding, what grounding is actually putting your feet on the earth. So it's not like you take your shoes off in a yoga studio that has wood in between you and the earth and think that you're going to become grounded, because you don't. Grounding is literally having your skin or something that it conducts electricity on your feet or on your body. So if you were to lay down on the ground and you have synthetic cloth on, you're not going to conduct it that well. If you have rubber on your soles of your feet, you don't conduct it. Leather does. And what earthing actually is, and this is actually scientific, is that we have all of our processes in the body create a positive proton heavy environment, and it's called oxidation. And as we actually ground to the earth surface is very heavy in electrons. And so, as we've all learned at some point, that or opposites attract. And so those electrons will actually come up through the skin, because we're mostly water, and it will actually neutralize those protons. And so it helps to neutralize the inflammation in our system. And they did do a study about blood pressure, and it showed that and this is a lot, but if you do 10 hours per day of earthing, that you can get an average decrease in your blood pressure by 14.3%, which would be almost around 20 points if we're talking about a blood pressure of 150 or around there. Now, that seems pretty impossible, considering most people today do not go out barefoot or lay on the ground for 10 hours a day. We have a lot of things we have that are very important to do. But there's actually products out there. I prefer to go through earthing.com, which was the original company that started to have these products, and they are legitimate products. I use them myself on my bed, and they have sheets that you can actually put into a ground. If your electrical system is grounded properly, you can actually plug that in, and it will actually do the same thing as if you were laying on the ground. So pretty interesting. I highly recommend looking into it, from many different aspects of health, but I thought I would put that in there because there's actually studies to show the benefit of that. Another one is magnesium. Magnesium is one of the strongest relationships of improving blood pressure of 61 substances that was done in the Honolulu Heart Study. And it can decrease your blood pressure by about 5.5 systolic and 3 diastolic. One of my favorite minerals. I recommend it a lot for so many different reasons, from sleep, relaxation, anxiety, diabetes, but it also helps with heart. And then vitamin D. If you are not sufficient in vitamin D and then you become sufficient, it can drop your blood pressure up to 7 points. And then one of my other favorite substances is coenzyme Q10. And 100 to 300 milligrams for about 5 months can decrease your blood pressure, and to the ability that you might be able to stop one blood pressure medication. So that's another thing that's really interesting with CoQ10. That is something that your body makes. Sometimes as we get older, or nutritionally, we're not as sufficient as we need to be. We may not produce quite as much. So those are some things that are really big ones that can be helpful naturally to help with blood pressure. So let's go on to cholesterol. Cholesterol is a little bit of a numbers game. Cholesterol is a little bit of a numbers game, but it's not a numbers game. It's just that that's how we read it. That's how we're able to understand it. So you go to your doctor and they say, oh, this is high or this is low. But what cholesterol suggests to us is whether your body is having significant inflammation that could be causing it to start to have heart disease. And the higher the numbers go and the different ratios that we see, the more likely we're going to have an issue. One of the things that I like to point out is, honestly, total cholesterol really doesn't matter. It's really the other numbers that make a bigger difference. HDL is your happy cholesterol, and that you want to keep around 50 to 80. Some of that is genetic. Some of the things that can be very helpful with increasing your HDL is exercise and omega-3s. Your non-HDL cholesterol, this is your LDL, your VLDL, and a few others that kind of go in there as well. If you add them together, then that is you want your non-HDL, your not happy cholesterol, to be under 130 without heart disease, or under 100 if you do have any signs, symptoms, or findings for heart disease. Triglycerides. So according to our labs, the recommendation is under 150. But 150, if you get to 150, there's some inflammation going on there, and I start to see more likelihood of prediabetes and things like that with a higher triglyceride. I do recommend, and most integrative medicine doctors recommend, keeping those triglycerides as low as possible, and that's going to be under 100. The way to do that is through your sugars and decreasing your carbohydrates, mainly. There's a lot of other things that can add to it, but that's probably the biggest, easiest way to do that. Last year I did talk a little bit about some advanced numbers, and I think that these advanced numbers are really important, so I'm going to explain them just briefly. Your LDL particle size is how small or big that particle is. You actually want really big LDL particles. And that happens from inflammation. So they become smaller and smaller the more they are oxidized or inflamed. And the same thing can happen to HDL. So if we start to see HDL continue to go up past 80 and it just keeps going up, then honestly, you probably don't have really great productive HDL particles. So LDL has a purpose, and the healthier and less oxidized those particles are, the more they're going to do what they need to do. But there is a purpose. It's not like we want to get rid of all of them, and they are actually really important in brain health. So we want to have some LDL particles, and we want them to be nice, big, and fluffy like a teddy bear. Lipoprotein A is another one that's important. This is a genetic molecule that either we genetically make more of or we don't make it. It's not quite that. There's different levels of which we make it. We start seeing it up above 150. It's really concerning. The preference is to keep the lipoprotein A down under 50. The lipoprotein A is a particle that some people make more of, that's like this little cap, and here's your LDL particle, and it just sits on top. And it makes it more likely to cause plaque in the arteries. So some people are just more genetically predisposed to this. People who usually have a family history of more serious heart disease issues, especially when the males get to be around 50 and females start to get around 60. We see this more and more. That's something to know about that. And whenever I see the LDL particle size above 1800 or the lipoprotein A high, I do like to do something called a CT calcium score. And most insurances won't pay for it, but it actually is really great because they're not expensive. They're not super expensive. It's about $100 to $200, and it can actually show how much plaque is in the arteries, if any. And so I have some people who might have higher cholesterol and even have a higher lipoprotein A. And what happens is I do a CT calcium score and they have a perfect score. And I'm like, okay, well, we have some room to play with this. Of course, we need to do it because over time it is going to develop if we don't. But we have some room to play versus I have somebody who has a higher score and I'm like, nope, we really need to talk about this and get very serious about it. So those, the lipoprotein A and the LDL particle size give me a lot of indication of how much room we have, and that CT calcium score gives us a great risk of how much the cholesterol is affecting somebody. Oh, what just happened here? Here we go. All right, so let's talk about statins. A lot of people are scared of statins, and I want to state that this is probably one of the best medications that we've come across in the last 50 years of medicine. And it's not my favorite. There's a lot of aspects about statins that I do not like. But when it comes to risk of coronary artery disease, heart attacks, strokes, your statins are something that really help us diminish that. So if you have a history of any plaquing in the arteries and it's known, you've had to have cardiac intervention, you have a significant history in your family of stroke, or you even had a small stroke, all of it is super, super, super important to take a statin. And if your non-HDL cholesterol is over 200, honestly, being able to take care of that naturally is pretty difficult in a timely fashion, unless you're willing to make some pretty significant lifestyle changes. And even sometimes for some people, from a genetic perspective, it's just difficult, and the statins are necessary. But, something that a lot of people think is that statins can cause diabetes or increase the incidence of stroke, and that is not true. It also get concerned that it can increase dementia. That has never been found to be true either. What statins can do is it can decrease your CoQ10 production directly because it's in that cholesterol pathway. It can decrease your omega-3 stores. It can decrease vitamin E and D. It can decrease selenium, and can, especially for people who have thyroid issues, can decrease conversion to free T3, and it can decrease your sex hormones. So you're like, well, that's pretty serious. But the thing about all of those things is that most of the reasons that the statins do that are because of nutrient deficiencies that are in those other ones, like the selenium and the omega-3s. You can replace those. So if you're at high risk, I highly recommend getting on the statin bandwagon and trying to help yourself by getting, kind of providing some extra support from the other perspective, because that's going to be your best benefit. And I truly believe that the conversion to T3 has to do with selenium, and the decrease in sex hormones have to do with the omega-3 stores. And all of that is something that you can help to provide yourself if you do need to take a statin. So dietary changes in cholesterol. The most significant studies for cholesterol honestly go to vegetarian or pescatarian. My concern with the vegetarian is getting the protein amount that you need, but there's a lot of vegetarians and vegans that actually are able to do that. So you can make that choice to be vegetarian or pescatarian and get the protein that you need. You want to make sure that you're getting all of your omega-3 fatty acids. They affect the triglycerides significantly, the HDL and that VLDL, which VLDL is a little bit more linked to triglycerides than the LDL. It can decrease the lipoprotein A, and it can also decrease oxidation from the inflammation. And we talked about the amounts that I recommended, which is 1.2 to 1.6 grams per day, but they've even found benefits increasing it up to 4 grams per day. Green tea, for all of the reasons of its antioxidant capacity, and you can take it as a supplement or you can drink it. I prefer drinking it. So everybody's a little bit different on that. Olive oil for the same amounts we were talking about. And that 3 to 4 tablespoons a day is approximately 30 to 40 grams per day of the olive oil. And then garlic, for all the reasons that we talked about before, is super important. It increases nitric oxide. It also increases our main anti-inflammatory that our body makes called glutathione. It also decreases that oxidized LDL, so it can significantly change that LDL particle size. From a supplement perspective, I really like niacin. Some people can't tolerate it. You get the niacin flush. I do recommend extended release niacin, and there are a few products out there that are there, like Niavask, which is from Zymogen. That's an extended release niacin. It is not required to do more than about 500 milligrams per day of this. They used to do really high doses and found that it can affect your liver and these other things. So I've had people come back to me stating, well, I saw that niacin can do this and I don't really want to take it for that. At the 500 milligram dose, it does not cause those negative aspects. It can cause the flushing, and the flushing is called the red dragon syndrome. It can cause a little bit of irritation and almost a little bit of itchiness. It lasts for about 20 to 30 minutes if it happens, and most people in the extended release don't get it every day. And honestly, they get it pretty rarely. But niacin actually helps to decrease triglycerides, increase the HDL, it decreases the LDL or the non-HDL, and it can also directly affect that lipoprotein A. This is another reason why I really like it. And I've actually seen somebody not make any lifestyle change, start taking niacin, not have any change in their counts, except for that LPA drop by 50 points, which was pretty significant. So niacin can be very helpful with that. Like I said, it's about 500 milligrams. Red yeast rice, to really get full effect, you need about 2,000 to 2,400 milligrams per day. It does have a statin-like effect, so it can have happen with statins. but it can decrease that LDL up to 22%, which is pretty significant. It also can help to decrease triglycerides. It helps to decrease inflammation, and it increases nitric oxide. Another one is plant sterols. A good one of those, which most people have probably seen, is Cholesterol by Nature Made, and that's your plant sterols and stanols. It can decrease LDL by about 10%. It can decrease your inflammation, your hsCRP, and your cytokines, and that requires about 2 to 2.5 grams per day of the plant sterols and stanols. So I have put berberine in my last few webinars, and it's with some hesitation because I always have to disclaim this herb. Berberine is an amazing herb. It has significant health potentials, but it also has significant interactions with medications, almost every medication out there. It has significant interactions with other herbs. So unless you're pretty much on just a multivitamin and omega-3, you probably shouldn't take berberine. But berberine is pretty cool, and it can decrease LDL up to by 25% and triglycerides by 35%. You cannot take it if you're pregnant or breastfeeding, or planning to. But the dose is around 500 to 1,000 milligrams per day, and that's pretty safe if you are not on any other medications and that kind of thing. The one that I found to be most interesting was citrus bergamot. That's actually pretty safe, has very few medicine interactions, and it can actually decrease LDL by 30%, triglycerides by 39%, and it can increase HDL by 40%. And that requires about 1,000 milligrams a day. So I thought that citrus bergamot was a pretty interesting one. All right, let's see here. You know, heart, there's new research into heart disease that says, and heart says, let me stop you there. If you're going to make me choose between you and pizza, it's going to be pizza. So pizza is not my thing, but chocolate definitely is. Chocolate would be my thing in this one. So definitely I have to be careful when it comes to chocolate. All right, let's see here. So talking about arrhythmias, I'm going to go a little bit faster through this, and I probably will put a little bit more emphasis on it next year. If you're feeling that, you need to go to the office or hospital and get an EKG. You just do. But at home, a lot of times you don't catch it on EKG, especially if you're having it, it's away. At home, you can actually get something called the KardioMobile, which is a 3-lead EKG, or an Apple or Android watch, which is a 1-lead EKG, if you hook it up appropriately with your phone. And I will tell you that the KardioMobile and the Apple or Android watch are significantly cheaper than the Holter or Vent monitor, which you typically have to do through a cardiologist's office or through the hospital, and can be quite expensive. Sometimes we need those, sometimes it's more urgent, but the KardioMobile and the Apple Android watches are really cool and can provide a lot of information. You do want to work with your provider if you're going to do that, because it, just like an EKG can sometimes say certain things that it's not truly there because it's artifact. The KardioMobile on the Apple and the Android watches have the same problem, so you have to be careful with that. But arrhythmias, typically when they did a study monitoring it for longer periods of time, they did find that about 34% of people who had palpitations had arrhythmias. And about 20% of people, it had to do with episodes of anxiety and depression. So understanding that your heart can feel like it skips a beat, not just because you're in love, but because you might feel a little anxious. So important to note that, important to get it checked out regardless. Palpitations or arrhythmias can be worsened by gastric distension. So those big meals should probably go by the wayside. Alcohol. I've had a patient who found out that the minute he stopped drinking, even just one per day, he stopped having AFib completely. Caffeine there's been studies that have shown yes and no on that, but any kind of stimulant is going to make your heart a little bit more irritable if you're already tending that way. Trans fats, so those are those fats that we want to stay away from as much as possible. Found a lot in pastries and desserts. So I highly recommend staying away from that. High amounts of sodium and other stimulants can definitely help to worsen arrhythmias and palpitations. So some of the things that can help: exercise. If it is a very concerning arrhythmia, you want to have this overseen by your doctor. I think anybody who has had any kind of been hospitalized for anything cardiac should see if they can get in for cardiac rehab, because that is one of the safest ways, and they can get you back to a safe place and knowing what your levels are. Also, acupuncture can be helpful as long as you don't have an ICD. If you have an ICD, you cannot use that. Magnesium can also be really helpful. My mother-in-law had problems with arrhythmias, and she still does from time to time, but they were trying to do an ablation to stop it, and it didn't. The first two didn't work. And when I finally got her on magnesium consistently, when she a month after they did that, they did the third ablation, and they were actually able to get her into a normal rhythm. Hawthornberry is another one. I said I was going to talk a little bit more about that. Hawthornberry is actually really cool. It decreased events of arrhythmias. Like I said, it doesn't have any medicine interactions and has a pretty high dose that's safe. Recommended amount for that is 160 to 900 milligrams, so not even close to the safe dose that they had checked out before. So Hawthornberry is an interesting one. To jump to L-carnitine in a minute, because that one's a really interesting one for this and the next topic. Motherwort is actually considered to be the anti-arrhythmia kind of herbal. It's kind of harder to find from a perspective of getting it safely. So, and you have to be very careful with herbs. So I do want to state that as a disclaimer. Gaia Herbs is actually a really good company to go by. They are very good with making sure that they process them appropriately. But they have found that 2 to 4 grams of dry herb and motherwort can actually be helpful in arrhythmias. And then CoQ10 has also been found, that same 100 to 300 milligrams that was found to help decrease blood pressure, also can decrease atrial fibrillation, and then meditation as well. What the studies have found that with meditation and palpitations, it can actually decrease the risk of sudden death in arrhythmias. Now, going back to L-carnitine, which is right at the bottom of that heart, L-carnitine I haven't talked about yet. It can actually improve left ventricular function. It is an amino acid that our body should be able to make, but sometimes we don't have enough of everything that we need to make some of these things. And once we utilize something, a lot of times it's hard for our body to replenish those stores, especially if we're under a lot of stress. So it can actually reduce arrhythmias, decrease ischemia, and the amount that is recommended is about 3 grams per day. It has no known adverse effects. So pump up the volume. This is congestive heart failure. This is going to be our last topic. I want to state very clearly that if you have heart disease or heart failure, you have to stay with your doctor. You need to be seeing your cardiologist. You need to maintain your medications. One of the biggest things that I see what I saw when I was a hospitalist, every Thanksgiving, Christmas, and especially 4th of July, the day after, we'd have tons of patients come in with congestive heart failure exacerbation. And that had a lot to do with the fact that they weren't staying on a low sodium diet. So that is very important. If you have congestive heart failure, you do not have a lot of room to go one way or the other. You really have to kind of stay pretty consistent with that. The DASH2 diet has the best findings for congestive heart failure. 2 of the biggest things that can be helpful is CoQ10 and carnitine, which those both help to improve mitochondrial function in the heart muscle and start to help it to pump better. And then hawthornberry and arginine. So hawthornberry can enhance the pumping by helping with the left ventricular pumping action, and it helps to both of them help to improve coronary artery blood flow. So arginine is also about 2 to 3 grams broken up into a couple doses. Arginine helps increase nitric oxide significantly. It's one of the amino acids that does that pretty effectively. So arginine is very good from a lot of different perspectives, but helpful in this as well. And the CoQ10, carnitine, hawthornberry, and arginine are all pretty safe. Like I said, the hawthornberry does not have any medicinal interactions. All right, so a healthy heart, nothing beats it. I hope you enjoyed today's webinar. These are the references that I had if you're interested. And at this point, I'm open to any questions.
Thanks, Dr. Ridgley. We did have two quick questions. People wanted a reminder of what is considered an omega-6.
That's a good question. So your like canola oils, your vegetable oils have a lot more omega-6s than omega-3s. A lot of processed foods, the fats that are in those are more the omega-6s than the omega-3s. And it's not that the omega-6s don't have a purpose in our body. We do need them, but it should be a 1-to-1 ratio, and we take in way too many omega-6 over omega-3s. So usually some of those fats that are coming from a lot of the processed foods or from some of those processed vegetable oils.
Ah, okay. We did have another question. One of the respondents wanted to know, they have a friend who has very high cholesterol and is on the highest dose that you can have of a statin. And this person is trying to avoid, the next stage of what that could be. But what would be, you've covered a lot about what you can do to lower your cholesterol, but if you're in sort of what would be considered an emergent situation, what are the actions that someone can take immediately?
Just like stopping smoking, starting to exercise and eating right and making those sudden changes have instantaneous effects on the body, decreasing inflammation and improving it overall. Cholesterol is not going to drop immediately. It's just not. But those would be the number one things that have to change. And I've heard stories and I've seen patients who make such a dramatic change that within 3 to 6 months, they've completely shifted their risk profile just from making healthy choices. So, I mean, honestly, getting in with a healthy nutritionist who can manage heart disease and getting that exercise in, starting with that graded exercise program is probably two of the best things that a person could do. Any of the things that I mentioned with the cholesterol, I would not recommend taking red yeast rice with a statin. But niacin, 500 milligrams, is perfectly safe with a statin. The plant sterols and stanols are completely safe with a statin. And even the citrus bergamot can be really safe. Berberine is not. So there's a lot of options from kind of a natural perspective that could be done that could help to decrease that as well. But the diet and exercise are probably the two most important.
Okay, thank you. Those were the two questions that we had, and we very much appreciate you always sharing such incredible information with our community, and we'll look forward to your next presentation.
All right. Thank you. You all have a great night.